Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about pertussis. Pertussis, or whooping cough, is a highly contagious bacterial infection. The name was derived from the high-pitched whooping sound that is common after a coughing fit. Before the vaccine became available in the United States, there were about 200,000 children infected and about 9,000 childhood deaths each year. Since the vaccine became widely available in the United States in the 1940s, there has been about an 80% reduction in cases. Currently, there's anywhere from about 10,000 to 40,000 cases each year, with up to 20 deaths per year. Pertussis has never been eradicated. It is a cyclical infection that peaks every 3 to 5 years. Worldwide, it is estimated that there are over 24 million cases and over 160,000 deaths each year. Pertussis is spread through respiratory droplets from the mouth, nose, and throat, and it may be from sneezing, coughing, laughing, or touching an infected surface, then touching your mouth or nose. One infected person can spread pertussis to up to 12 to 15 other people. The incubation period for pertussis is about 5 to 10 days. Initial symptoms include mild coughing, sneezing, runny nose, low fever, and possibly diarrhea. About 1 to 2 weeks later, a person develops intense coughing spells, followed by a long gasp for air, as it is difficult to breathe. These spells may last up to a minute. The gasping sound may be a whoop, for which the infection gets its name. Some adults may not have the whoop, but just a cough that does not go away. Infants may not cough or make the whooping sound. They may only be gasping or trying to catch their breath, and may have periods of apnea, or not breathing. Sometimes people vomit after the coughing fits, and their skin may turn purplish or bluish around their mouth while coughing. They also can experience extreme fatigue after coughing. During the final stage, the cough is less severe and less frequent. It may last up to 3 months. Pertussis is often known as the 100-day cough. A person is contagious up to 2 weeks before the cough and 3 weeks or more after the cough if there is no treatment. This contagious period may be shortened to 5 days after the start of proper antibiotic treatment. Diagnosing pertussis may be done through a combination of a physical examination with medical history, a nasopharyngeal swab, a blood test, and a chest X-ray. Antibiotics are used to treat pertussis to shorten the length of the infection and prevent the spread to others. It does not, however, get rid of the cough unless it is taken very early in the illness, which is when the medicine is most effective. You should not use over-the-counter cough medicines, suppressants, or expectorants, as they do not work and they may be dangerous in young children. Drink plenty of fluids to prevent dehydration. Eat smaller, more frequent meals. Be sure to get plenty of rest. You may use a cool mist vaporizer to soothe lungs and airways. Keep the home free of irritants that can trigger coughing spells. This can include aerosol sprays, tobacco smoke, or fireplace smoke. Those who are at a higher risk of developing pertussis include close contacts of someone who is infected, and anyone who is not fully vaccinated or has not been vaccinated for several years, as the immunity wanes over time. Infants are at a high risk for complications, especially those 6 months and younger. Potential complications for pertussis infection may include apnea, dehydration, broken blood vessels, rib fractures, urinary incontinence from coughing fits, pneumonia, seizures, encephalopathy, hospitalization, or death. A person may be hospitalized for requiring oxygen supplementation, IV fluids, airway suctioning, antibiotics, and close monitoring. About half of all babies less than 1 year of age who get pertussis are hospitalized. Of those babies who are hospitalized, about 1 to 2 in 100 will die. This is more common in infants younger than 3 months of age. A person should contact a doctor if they have been exposed to pertussis and are susceptible, especially if they are high risk for complications. You should also call the doctor if you develop symptoms of pertussis or the symptoms become more severe, such as difficulty breathing or signs of dehydration. The best way to prevent pertussis is to get vaccinated. There are 2 vaccines available that provide protection not only for pertussis, but also for tetanus and diphtheria. DTaP is available for younger children, and Tdap is available for preteens, teens, and adults. The DTaP is about 80 to 90% effective, and the Tdap is about 70% effective. It is recommended that the DTaP be given at 2, 4, 6 months, 15 to 18 months, and 4 to 6 years. The Tdap should be given at 11 to 12 years. Anyone 13 or older should receive 1 dose if they did not receive it before. Pregnant women should receive the vaccine during each pregnancy between 27 to 36 weeks. This can help pass on antibodies to the infant for early protection. One study found this to be 85% more effective in preventing infections in babies less than 2 months of age. The vaccine is especially important for anyone in close contact with infants, since they are highly susceptible and at increased risk of serious complications. People should be vaccinated at least 2 weeks before contact with the infant if the vaccine is needed at that time. Many infants who get pertussis are infected by parents, caregivers, or older siblings. Indiana requires the vaccine for all kindergarten through 12th grade enrollment. Many colleges require it as well. There is no lifelong protection with either infection or the vaccine. Antibiotics may be given to people who are infected to prevent the spread to others, as well as may be given to close contacts with someone who is infected. This may include household contacts or kissing partners. Be sure to avoid others if you are infected. Stay home from work or school while contagious. Cover coughs or sneezes with a tissue, upper sleeve, or elbow, and be sure to wash your hands often. This concludes the pertussis presentation. If you have any questions, please contact your doctor, local health department, or visit any of these websites. Thank you.